Good evening, friends. I am conducting this live session a little bit late because of some like etiquette note was not available with me. So today I wanted to make this discussion on our body posture, our breath, and the heart health. Our heart, the most important body organ in. So lots of people very young age they have died due to heart ailments, heart attacks. So that query came into my mind, that why at certain young age the heart problems has become so much like there among the people, and people are even sufferers of heart ailments, they have even died. So what could be the reason? And the importance of our heart health, of course. Please excuse me for my condition of mobile because it is really giving lots of trouble. But then I wanted to relate the heart health to our breath, because in today's world when we are thinking that our work should be really fast, the whole world is going so fast, so everybody is in a hurry to carry out their works. And in that way, uh, our breath matters, our breath speed, that has also like increased, and our length of the breath that has decreased. The way, the length that inhale and then slowly exhale, so that inhalation and exhalation should be longer for long time. But in today's fast world we find that our breath length have decreased, and the speed, the rate, means palpitation of our heart, that also matters. So that has increased. And in case of heart ailments especially, there are certain symptoms. So among them, I have consulted my yoga book. This is my yoga book. So here some of the very important symptoms of heart diseases are unnatural, non-rhythmic, and audible palpitation. Means when our heart is palpitating. Please excuse about the mobile screen because it is giving problem again and again. So palpitation of the heart becomes really fast. That is one of the symptoms that we should be concerned about. Okay, it is going like this. Let me let me do it like this. So the palpitation rate increases a lot, and there is a ache in the left side of the chest over here. So we tend to feel that pain in the chest, difficulty in inhalation and exhalation. Means we are, suppose I am feeling a little bit of difficulty in breathing in and then slowly out. So that is also one of the symptom that there could be heart problem, heart diseases. And in our general life we might not realize the extent of heart problems. But since in today's fast world where everybody wants to carry out their activity very fast, we should care about our heart, because that is the most important organ inside our body. So these were some of the causes, sorry, the symptoms. And there are a lot of causes, starting from the food we eat, the kind of food we eat, then the digestion of the food, then the lifestyle of any person, means whether I am including exercises, yoga, walking in my daily routine or not, that matters. Then the process of excretion, whether my excretory is going well or not. If I am having constipation, then that could ultimately lead to heart problems also. Then uh, about food, actually it is said that animal food products, fatty foods, then the food which is actually a lot of like oil is added, oil, ghee, then it is roasted, burnt food, so those food. And again, the way we intake, like if I am not having appetite, then also I am gorging lots of food, so that could also give rise to heart problems. And greedy people means some people might have really like good taste about some food and they gulp a lot of that. So greedy voracious eaters could also ultimately end up into heart problems. Then another reason is the heart has to undertake extra labor in sexual intercourse as well. That is why excessive lust is another cause of heart disease. So married couples, this will be applicable in case of married couples, that the excessive lust, that could be another reason for heart problems. Then in case of tropical countries like ours, India is a tropical country, and also in cold countries, people who indulge in fish, eggs, meat, and concentrated foodstuff like ghee, butter, cheese, sweet meat, and almost every day, if somebody is having a little bit of meat, flesh, or butter, cheese, and another person is having it in a regular daily diet, so there would be difference. Then the fat accumulation in the body. So overall, if a person's body is like fatty, so he or she has to consider about their body fats actually. So especially the stomach region, the belly region. So if the belly region is like a lot of fats has accumulated, then that person has to think about having heart problems. Another cause is excessive tea, coffee, tobacco, cigarette, wine, opium. So these also deviate the nerves, arteries, and glands by their toxins, and the heart has to share the consequences, such as excessive habits of intoxicants is another cause of heart diseases. So tea, coffee, tobacco, cigarettes, wine, opium. So this could also give rise to heart problems. Then the blood pressure, people suffering from blood pressure, beriberi, pneumonia, pleurisy, rheumatism, syphilis, sthitis. So these are some ailments, diseases which could also ultimately give rise to heart problems. So in case of heart, there could be many reasons, and the heart problems are also different. Cardiac problems, I'm not a doctor of course, but then I'm a yoga practitioner. So the heart problem is not just one type of heart problem is there are many types of heart problems. A cardiologist would know it better, but then the causes are very much means general people should know about it and try to manage our lifestyle. So what I wanted to come to the point that since the heart is related with our breath, and pranayam, because pranayam can do a lot of good effect upon our heart, and not just our heart but the entire body. But heart is directly involved, because when we breathe in and breathe out, our lungs are active. So our lungs take in long like breath and respire out the exhalation, taking out of the carbon dioxide from the body. So when that is functioning well, our heart also gets a lot of strength. So doing pranayama, like many patients have already said, and nowadays even doctors also recommend for heart patients to do pranayam. My mother is one such fellow who has who I will try to take her views also and include it here, that pranayam has really helped her working with heart diseases and heart ailments. If somebody is not having heart problems, then also they should do pranayam. And pranayam is actually affected by body postures, and body postures affect the breathing. So I want to come to that point, that how our breathing affects the body posture, and our body posture actually affects the breathing. So in another video I have tried to show that the proper body posture, like when I am sitting, I need to come to a correct position, and like when a human being is sitting, when a human being is standing, and when he or she is sleeping. So for all the three types of body postures, there are certain do's and don'ts, means some postures which we should always avoid, and some postures which we should always try to come to that position. And one such is the sitting up straight while we are working. I do not know whether it is visible. Let me see for once. So suppose this is my sitting posture, then the backbone should always remain straight. The back, there's a spinal cord which runs from our like the neck region till our lower back. So the spinal cord needs to remain in straight position. But we tend to become lethargic, and we tend to become like slow and sluggish. Let me come to a bended pose maybe, because this seems to be so relaxing, and we tend to come to that position. Like I try to show that while we are reading books or we are writing, then the straight posture is required, but we tend to come to, like I am trying to take the support of my shoulder like this. Let me sit, let me read, take a pen and then write. So my whole posture has actually changed, the straight position, because why this like the backbone straight is required, because like this the whole thoracic, the lungs, where the lungs are present, the lungs can take in full volume of the air. We are breathing it and we are breathing out. So the full volume of the lungs is required, and that is possible only when I am sitting up straight, my backbone is straight. If my backbone is straight, then the thoracic, means the rib cage and the where inside the lungs are present, so those lungs can come to take in, breathe in full volume of the lungs, full volume of air inside my lungs, and then take out, breathe out full volume, like it is released. So then only when the body posture is straight, then only the full volume of the lungs is possible. Otherwise, if I tend to like come to this position, then the lungs is not able to respire full volume. The lungs would be compromising, and to lower extent of air, lower percentage of air would go inside my body, and that will definitely affect the breathing process and the heart functioning and various other functioning of our body organs. So this is very important that people do consider sitting up straight and inhale full volume of air, full volume of oxygen. So while sitting, this is a position, and while standing and sleeping also, I have already made a video earlier, maybe 2 or 3 years back. So I will share that to my web page, this post page of YouTube, and I will try to make some more videos so that I can show, because right now actually it is not possible to show the sleeping position or the standing posture also. Okay, standing posture maybe I can show in my room here only. So when we are standing, suppose, so when we are standing, so while standing also our back should be straight, but when we are like talking with somebody, then we take our hands back and little bit of bending of one knee, and then take this position, or like this only. So we keep on changing our position, or we can take support of some wall or something and then try to speak to somebody like that. Suppose this is a wall, then I will take to, is it visible? It is not visible over there. I will make another video. So we tend to take support from walls, and we bend our straight position to a slanted one, to a bend one. So all these positions do not give the full volume of our lungs. That is restricted, and that is how the body postures, it affects our breathing. Our lungs cannot breathe, so that is why we should go for the correct posture, correct body posture. And a lot of other related like points are there. Actually there are many points, so it is not possible to discuss. Already I think 15 minutes have gone. So let me very briefly mention one or two points. Yes, one point is that heart trouble cannot develop unless the stomach is enlarged. So in this book, the enlargement of the stomach means the fat accumulation inside in our stomach region, that we should always notice. If that is there, then we might face heart problems. And there are rules and diet, for diet also. So those things I will try to include in another video, because this video has already gone quite long. So thank you for joining me at this time, and do care about your health, because that is the actual possession in our life. No other name, job or relationship is as important or as dear to us as our health. And doing yoga will definitely benefit. It has benefited me in lots of years, and I am very much sure that it will affect everyone. So thank you for joining me today. Thank you. Bye bye. Good night.